Generational poverty creates significant barriers to sexual health by limiting access to education, healthcare, and economic stability. Individuals born into poverty often face inadequate sex education, restricted access to contraception and reproductive health care, and higher rates of sexual exploitation and violence. Systemic inequalities, such as lack of affordable healthcare and stigmatization of marginalized communities, further contribute to higher rates of sexually transmitted infections, unplanned pregnancies, and poor overall reproductive health outcomes. Breaking this cycle requires comprehensive policy changes, community support, and increased access to resources that empower individuals to make informed decisions about their sexual well-being. Sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. It goes beyond the absence of disease or dysfunction and includes the ability to have safe, consensual, and fulfilling sexual experiences. According to the World Health Organization, sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as access to comprehensive education, healthcare, and protection from violence, coercion, and discrimination. It encompasses reproductive health, STI prevention and treatment, contraception access, informed decision-making, and bodily autonomy. True sexual health is rooted in human rights, ensuring that all individuals, regardless of their gender, sexuality, or socioeconomic status, have the knowledge, resources, and freedom to make choices about their bodies and relationships. From the perspective of people impacted by generational poverty, sexual health is often shaped by survival, limited choices, and systemic barriers. It can mean navigating relationships without access to contraception, fearing judgment or denial of care from healthcare providers, or facing the reality that economic instability makes it harder to leave unsafe or exploitative situations. Many experience stigma when seeking sexual health services, while others may lack basic education about their bodies and reproductive rights. For some, sexual health is tied to harm reduction, prioritizing safety in environments where options are scarce. True sexual health, from their perspective, isn't just about avoiding disease or pregnancy. It's about having autonomy, access to non-judgmental care, and the ability to make empowered choices free from economic coercion. Talking about sexual health should start early, with age-appropriate conversations that evolve as a child grows. Early discussions, ages 3 to 5, can focus on body autonomy, consent, and the proper names for body parts. As children enter elementary school, ages 6 to 10, they can learn about puberty, boundaries, and basic reproductive health in a way that emphasizes respect and safety. By pre-adolescence, ages 11 to 13, more detailed conversations about sex, relationships, contraception, and STIs should begin, ensuring they have accurate information before they become sexually active. Comprehensive, ongoing discussions that are honest, shame-free, and tailored to a child's maturity level help build a foundation for lifelong sexual health and informed decision-making. Talking to children ages 3 to 5 about their bodies and boundaries isn't about discussing sex, it's about laying the foundation for bodily autonomy, consent, and personal safety. At this early stage of development, teaching children the correct names for body parts, distinguishing between private and public body parts, and emphasizing that they have control over their own bodies helps them understand their rights. These conversations provide essential protection and build lifelong skills in self-advocacy and personal boundaries. One of the most important benefits of early body education is the prevention of abuse. Children who understand that their bodies belong to them and that certain types of touch are inappropriate are less likely to be manipulated by abusers. Knowing the correct names for body parts also enables them to communicate clearly if they need to report inappropriate behavior. Additionally, fostering an understanding of consent at an early age reinforces that they do not have to hug, kiss, or engage in physical contact with someone if they do not want to, even family members. This teaches them that their comfort matters and helps them develop respect for others' boundaries as well. Discussing bodies in an open and matter-of-fact way also helps in reducing shame. When children learn correct anatomical terms and are encouraged to ask questions, they grow up feeling comfortable discussing their bodies without embarrassment. This normalization makes it more likely that they will seek help if something feels wrong. Furthermore, empowering children with knowledge about their bodies contributes to building confidence. When they understand their right to say no to unwanted touch and feel supported in asserting their boundaries, they develop a stronger sense of self-worth and bodily integrity. By starting these conversations early, caregivers and educators equip children with the tools they need to navigate the world safely and with confidence. These early lessons create a foundation for healthy attitudes towards sexual health and relationships as they grow older, reducing risks of harm and increasing their ability to advocate for themselves. The failure to educate young people, especially about sexual health, bodily autonomy, and healthy relationships, plays a role in perpetuating generational poverty. Lack of access to comprehensive sex education increases the likelihood of unplanned pregnancies, STIs, and exploitative relationships, all of which can make it harder to break free from economic instability. When young people aren't taught about consent, they may be more vulnerable to abuse, which can have lifelong emotional and financial consequences. Beyond sexual health, the broader failure to provide quality education, including financial literacy, career planning, and critical thinking, limits opportunities for economic mobility. When people don't have the tools to make informed choices about their bodies, relationships, and futures, they are more likely to stay trapped in cycles of poverty. Education, when it's honest, accessible, and non-judgmental, can be a powerful tool for breaking these cycles by giving young people knowledge, autonomy, and the ability to plan for their futures. Breaking the cycle of poverty and poor sexual health requires a multifaceted approach that tackles systemic barriers, expands education, and provides tangible resources for individuals and communities. One critical step is implementing comprehensive and inclusive sex education in schools. Evidence-based, non-judgmental curricula should cover topics like contraception, consent, healthy relationships, and bodily autonomy. Additionally, sex education must address LGBTQ+ health, trauma-informed care, and economic realities such as survival sex or reproductive coercion to ensure that all individuals receive relevant and empowering information. Breaking these cycles isn't just about individual choices, it requires dismantling structural barriers and investing in holistic, community-driven solutions. When people have knowledge, autonomy, and economic security, they can make healthier choices and build futures free from poverty and exploitation. Breaking the cycle of poverty and poor sexual health requires more than just individual effort, it demands systemic change, community investment, and policy shifts that prioritize autonomy, education, and access to resources. When people are given the tools to make informed choices about their bodies and futures, they are empowered to break free from cycles of economic instability and exploitation. It's time to break the cycle. We must demand comprehensive, inclusive sex education, push for policies that protect reproductive rights, and support organizations providing healthcare and economic opportunities to marginalized communities. Get involved, whether by advocating for policy change, supporting grassroots initiatives, or having honest conversations about sexual health and autonomy. Share resources, challenge stigma, and uplift the voices of those most affected. Change doesn't happen by accident, it happens when we take action. The fight for sexual health and economic justice starts with us. Will you join in? You can support our work by donating to SWOP Behind Bars.